हेलो फ्रेंड्स, गुड इवनिंग। और अभी हम डिस्कस करेंगे फंक्शनल न्यूरोसर्जरी टॉपिक, जिस पे क्वेश्चन आया है डीएनबी में फॉर 5 मार्क्स। एंड दिस टॉपिक इज गिवन इन अ पैराग्राफ मैनर इन लव एंड बेली, and along with that I have used some articles to create this point wise essay for the exam. So at least we have to study so that we can write at least 2 to 3 pages, and the link for the notes I will share in the description. So without any further delay, let's get started. So functional neurosurgery. So functional neurosurgery, it aims to treat neurological condition by altering brain function. तो ब्रेन फंक्शन को अल्टर करके हम कोई कंडीशन को ट्रीट करेंगे, एंड इसमें टेक्निक यूज हो रहा है एब्लेशन, डिस्ट्रॉइंग टिश्यू and stimulation of brain areas. So condition which is commonly this functional neurosurgery is used is epilepsy, movement disorders, chronic pain, and apart from that even tremors and some OCDs. So let's see some of these one by one. So commonly used for management of epilepsy. As we know, epilepsy is a common surgical disorder and seen in 10% of the population, and is very useful for patients with drug resistant epilepsy, which is among 20 to 30% of these patients. So for that we have three ways, that is resective surgery, disconnective surgery, or stimulative surgery therapy. In resective surgery, we remove the seizure focus area causing the seizure if it is located in a non-critical brain region, like it could be a cavernoma, arteriovenous malformation, or also we can do awake craniotomy for precise identification and preservation of critical brain function. Amygdala hippocampectomy for mesial temporal lobe epilepsy. Lobectomy, removal of a lobe for severe cases. Hemispherectomy for specific epilepsy syndromes in children. Then we have disconnective surgery, that is corpus callosectomy to sever the connection between two brain hemispheres. Subpial transection to isolate seizure focus. Then stimulative therapy, that is vagal nerve stimulation for reducing the seizure frequency. Then we can use this for movement disorder, which primarily focus on Parkinson's disease and essential tremor. Here we use deep brain stimulation, which is the primary treatment, and it involves implanting electrodes in the specific brain region, and it offers adjustable and reversible benefits compared to older ablation technique. Then we have pain management therapy through surgery, which targets chronic pain in case like trigeminal neuralgia. Techniques include microvascular decompression, stereotactic radiosurgery, percutaneous procedure with glycerol injection, that is Gasserian rhizotomy, nerve tract lesioning, that is chordotomy, and spinal cord stimulation. It aims to interpret the pain signals and address the underlying causes. Then what are the investigative tools which we use for assessing the condition of these? That is MRI, which visualizes the brain structure and abnormalities. SPECT or PET, which assesses the brain function and metabolism. EEG, that will assess the electrical activity in the brain to localize the seizures. And VADA test, that will help us in determining language dominance and memory function. And now we'll be seeing some details of the movement disorders. Sorry for the inconvenience. So surgical treatment of movement disorders. In this, here, before the advent of the drug therapies, the surgical ablation of the subthalamic nucleus or globus pallidus was used to manage Parkinson's disease. And now we have deep brain stimulation, which has replaced ablation as primary surgical treatment for Parkinson and other movement disorders. So it offers adjustable and reversible treatment, improves symptoms without causing deficits. Common targets are the subthalamic nuclei, globus pallidus interna, ventralis intermedius nucleus of the thalamus, and is useful for treatment of Parkinson's disease, dystonia, and essential tremor. Then pain management, surgery for the chronic pain which has not responded to other ways of treatment. Here we have the microvascular decompression, which involves moving a blood vessel away from the trigeminal nerve to relieve pressure. Then spinal cord stimulation, where an implant is placed near the spinal cord to deliver electrical impulses which can mask pain signals. Then cordotomy, which involves severing specific pain carrying nerve fibers in the spinal cord, and it can cause side effect like loss of sensation. Then dorsal root entry zone surgery, that is DRES, which is similar to cordotomy. This procedure targets entry point of pain fibers into the spinal cord. And lastly, the deep brain stimulation, where the electrodes is implanted in the specific brain regions to modulate the pain signal. Now we have microvascular decompression in detail, deep brain stimulation in detail, percutaneous Gasserian rhizolysis in detail. But before that, I would like to add some contraindication for these techniques. That is, if the patient is having severe comorbidities, severe comorbid contraindication like medical comorbidities which is rendering high risk for surgery, active or recent infection, uncontrolled psychiatric issues, and patient is not having a caregiver, and complication for these surgeries include hemorrhage, infection, device related complication like displacement, battery depletion, neurological side effects in the form of dysarthria, balance problem, mood changes, and sometimes even potential for worsening of symptoms. So this was all about complications and prognosis. It varies based on condition and individual responses. DBS, deep brain stimulation, provides significant improvement for Parkinson's, tremors, and dystonia. Chronic pain and OCD have a variable outcome, and long-term follow-up and adjustments are necessary. So this was about the prognosis, and now we can study something about microvascular decompression in detail. So that is, it is used to treat trigeminal neuralgia, and the procedure here is we place a small pad between the vessel and nerve so that the nerve is separated from the blood vessel. The blood vessel is separated from the nerve and the compression on the nerve is relieved. So it has a high success rate and recovery is good. So this was about microvascular decompression. In deep brain stimulation, we place an electrode which is connected to a pulse generator implanted in the chest, and this electrode gives signals to the specific target of the brain. So effectiveness is variable depending on the patient and individual patient response. Then we have percutaneous Gasserian rhizolysis, which is useful for trigeminal neuralgia. And here we go for a needle placement under radiographic guidance in the Gasserian ganglion in the Meckel's cave, which is a cluster of nerve cells, to disrupt the pain signals. And the facial pain is reduced, and on that needle placement we either use glycerol injection, radio frequency heat, or balloon compression, and it is less effective than microvascular decompression but is used sometimes. It has also high chance of recurrence within 2 years. So this was all about rhizolysis, Gasserian rhizolysis. Other techniques like pallidotomy, thalamotomy, capsulotomy are used. We have to give intraoperative monitoring in the form of EEG and EMG. Post-operative management, we have to be careful regarding the complication and adjustment of the stimulation parameters. So in short, the functional neurosurgery is a complex field requiring specialized expertise, and it depends, the success depends on the precise surgical technique, advanced imaging, and thorough understanding of neuroanatomy and neurophysiology. So I hope this topic has been understood in short and can be studied in detail if needed. But as of now, it has been asked for 5 marks, but I have explained the content which can be written for at least 4 to 5 pages and can be written for 10 marks. So I hope it will be helpful for all the DNB candidates who will be appearing for exam. And keep studying, keep growing. Please like, share and subscribe, and never give up because great things take time. And see you in next video. Thank you.